Welcome. As chair of the Legislative Healthcare Coverage Commission, we take great pride in being sponsors of this event, and we are very, very happy this is here today. We have our first commission meeting of this year tomorrow, and I really view this meeting as kind of the first of the two-day commission meeting, and many of our commission members are here today. What I'd like to do is spend a couple moments talking about the Healthcare Coverage Commission, let you know our origins, our previous activities, our future goals, and just kind of place the commission in your eyes of what we're doing for healthcare reform in Iowa. Before I do that, I would like to take a special thanks to Chris Atchison, Sherry Hike, Brian Caskey, and Stacy Seifert for being on the planning committee to create this great event. I mean, we have fantastic speakers, a fantastic program. I'm going to sit back and take notes and learn as much as I can, and someone said be a sponge to try to take all the information we can take here from both the state and national perspective and be able to use that for the betterment of Iowans in the future. Let's spend a moment talking about the Iowa Healthcare Coverage Commission. We are now in our second of 3 years. We have 11 public members, we have 3 department heads from the state governments, and we have 4 legislators. Last year we met in kind of a sense of chaos because we had no idea what would happen. Our last meeting was this January when we finalized our final report to the legislature. At that point we had no idea what healthcare reform would occur. So our report was kind of somewhere between what we would do if no healthcare reform federally occurred and what we would do if federal healthcare reform did occur. At that time, I just would throw a couple of statistics that we used, or at least I used as chair to kind of guide me through the legislative, through that set of commission meetings last year. One of them is a source of strength. If you take Iowa as a country within all countries around the world and looked at our healthcare parameters as of 2008 and 9 last year, we would have ranked 13th in the world as far as Iowa healthcare. So we come as a element of strength in comparison to other entities around the world. One of my goals is was to try to make sure we advance up that list even higher and higher. But I was very proud of where Iowa was. Despite that, we had statistics like the following: 250,000 Iowans without health insurance as of last year. 140,000 Iowans in the individual marketplace, which, as you know, has been racked by high healthcare costs as well as the issue of a pre-existing condition. We had a report last year from David Lynn talking about small businesses and health insurance rates, and we learned that of businesses less than 10 employees, of which there's 66,000 in Iowa last year, 53% offered health insurance and 47% did not offer health insurance. So roughly 30,000, 32,000 small businesses in Iowa could not offer health insurance to their employees. We learned that a lot of rural counties in Iowa, if you look at the 200% of poverty level, 25% of those individuals in rural counties did not have health insurance. This year, a new statistic came out when we were talking about high-risk pools. There's 34,000 Iowans who currently do not have health insurance, have not had health insurance for the last 6 months, and have a pre-existing condition. Of that, this new high-risk pool, the federal subsidies that we'll be able to provide another 970. So we'll still have well over 30,000 Iowans without ability to ascertain individual market insurance. So what did we do last year? We came out with 7 recommendations after meeting throughout the year. Our commission was started by the legislature, as I said, two years ago, and we had several specific charges regarding a report at the end of last year, but our general charge was to chart healthcare reform strategy for the state at kind of the 20,000 feet level. And we were to come forward and make recommendations to the legislature and the governor in the state of Iowa. Our report last year, as I said, had 7 specific items as far as recommendations. I'm just going to go through 4 of them because 4 of them really make reference to where we're at today. 3 of them were embodied in a bill passed by the legislature, 2356, which included the establishment of a healthcare informational exchange, which based on what I can tell, we're like only the 5th state in the nation to actually have an exchange that's been legislative, signed by the governor, and anticipated we're going to start sometime in 2011. Our commission came forward and recommended this beginning the design of such an exchange. We recommended expansion of Iowa Cares and regionalization of Iowa Cares, such that Iowa Cares patients who, as many of you know, were those folks who came to University of Iowa or Broadlines Hospital to receive medical care, only 2 places in the state they could receive care. We recommend expanding that, regionalizing that, and offer them primary care. And we also went further. We recommend doing it under a medical home philosophy, such that medical home could be used as a way to provide better care in a more cost-efficient manner. We also recommended starting a statewide diabetic registry, and that those efforts are also undertaken. All those were in 2356 that were passed and are now law and they're now being worked on as far as the details. The final reports that I wanted to mention is that we recommend maximizing our ability to ascertain federal health care reform potential for a state of Iowa. So if there's programs out there that Iowa can engage into from the federal level, Iowa ought to be there right at the start of the line, trying to obtain more information, more financial resources to help the citizens of Iowa. This year we meet for the first time tomorrow. Prior to that, we have assigned work groups. That's how we did most of our working efforts last year. We have 4 work groups going on. I'm going to talk about them briefly. The first work group is a work group I chair. We're looking at high-risk pools, Iowa Cares expansion, Medicaid transition. I mean, one of the big efforts going on will be the Medicaid expansion to up to 133% of the federal poverty level in 2014. That's going to be a tremendous undertaking by the Department of Human Services. We're working with them to make recommendations how best to make that a successful transition. And finally, we're going to look at other ways to consider offering healthcare options, and we're going to look at healthcare co-ops in Iowa. The second work group is going to look at value-based healthcare under the leadership of Marcia Nichols. The third one is we have within the state law required to look at making recommendations regarding the exchange, the development of the exchange by the Division of Insurance, and Ted Thompson will chair that work group. He's already had 2 meetings in taking in data and information by which we can make recommendations from the Commission to the Division of Insurance regarding how to have a successful exchange that will be informational now, but in 2014 will actually provide the avenue where you receive subsidies above 133%. And finally, Joe Teeling will be the chair of a work group that has not met yet regarding prevention. So in closing, I would say that the future is this. In 2014, we're going to have healthcare reform. What will that healthcare reform mean? The way it sets, below 133% will be Medicaid expansion, above 133% will be offering through the exchange healthcare options for individuals, small groups, individuals, and the key for me is will we be able to have, number one, a successful, cost-efficient, high-quality Medicaid under 133%, and above 133%, will we have reasonable, affordable, high-quality healthcare options poor people to obtain in small groups and individual market. And to me, that's the necessity of what we need to learn today. So I welcome you here. I look forward to learning as you all. Thank you very much.